As Sheikh Malik has introduced me already, my name is Haruna Hassan. I'm a doctor with Heartlands Hospital. I live around here. I'm sure we've met a few faces around here. I pray mostly at Masjid Usman or Abrahamic Foundation Masjid, which is just near my house. And we had quite a long conversation with Brother Malik about arranging this kind of talks, which are very important in every community. And I think we have many targets. This is the first target, a community of individuals. And then after that, we decide what are the sub-communities in that community. Have we got more men than women? And then we arrange a talk for men and talk for women. Are there kids that require talks? Then we talk to the kids, and we'll go that way. The first talk we want to do today is a very important one. And the reason being that the way we treat diseases has changed. We always used to wait for the disease to occur, and then we decide to diagnose it and then treat it. We want to diagnose diseases before they happen. It is easier to manage a disease before you have a complication. CB, do you want me to be stopping intermittently so you can interpret?
Yes.
Okay. All right. Okay. So this talk is going to be about how you can help yourself to age gracefully. All right? Because a lot of times there are diseases that you cannot prevent, but you can age well with some of those diseases. If you can.
Aganya kebe kono ko himpo hana ko anidu ko akingari cherebe ko anati ere kayera kanta antala to ere so kebe ko aro imam Sheikh Malik ada kebe kacha ko kenyani namuna na kachanu gabu nya dabari kagale kebe dabar ne ko kenya hi kachana nga as an introduction ko na jamakeru mo be gelanga yigu nya gaben ya garunga ma ya garung karanga ko ele kenya tunu ka aro ka kane gelanga na ga ina mudo edo le munu gana ndiga mudome iyo keta agati ko wate halle ni watenga nyana mo be anterinke na ngana to imbirambe anna jara kadi sasa ken tagadi anna traini ya wateke anga katana mo be saro watake ke megarini. Yeah.
Okay, so I want to divide this talk into a few points. The first thing is we want to introduce the whole idea about this talk, and then we want to understand what health is and what is wellness. And then after that, we want to talk about what are the aspects of health. Then the problems associated with aging, how we can remain well as we age, and then when we go towards retirement, what can we do to remain well?
Yo ko ke diga megane kebe ko ke nyane wala kenyane khirsa ko pat hakatinga yo kenyane kinga tam hakatibe yanai kenanya harsa yonki hanga we yo ko diga meke manam pai ay kenya kamma.
Tamam. Okay, just as a form of introduction, everything we do, we are Muslims. That comes to the forefront, and everybody agrees that the best doctor in the world is Prophet Muhammad sallallahu alaihi wasallam, and he came down with revelations from Allah subhanahu wa ta'ala, telling us about our way of life, health, diseases. Everything is mentioned in the Quran. And I just wanted to start with this ayah from Surah Rum. And what I want us to appreciate from this is we've been told about whatever I'm going to talk about. Whatever I'm going to talk about today, it's been mentioned previously at the time of Rasulullah when the Quran came down. And the main thing about this ayah I want us to remember is that we start weak, we grow to our strongest, and we become weak again.
Iyo qala kebe ko digame ke ko inshallah garini digame suko hanya na digame anati hadith yana ko nya faris sallallahu alaihi wasallam anda kun digamu ko bodanga nati ko lay jarande wala anati doctor gore e bantini farenya ke sallallahu alaihi wasallam iyo agara kebe ko digal lagare ke just the last bit that you said.
Okay, so this is Surah Rum, and it describes how we are born weak.
Yo agara kebe ko hada marembe ngana sare birambe allam punta nyani kirana lanan ko ro nanan kita annan kinye tembo ngabe ko an kinya an sembe pakatinga kinga dangi alin la punta ko nya kadi.
Okay, so if we look at this ayah and look at this diagram, you'll find that In medicine, we describe something called the extremes of ages. When you have your kids, you're always told, take them for vaccination, take them to the hospital, let them get checked, because they are da'if, they are very weak. In terms of diseases, this is the best time a disease can catch a child or human being, and they need a lot of help. And even as they grow towards teenage, anything within that red box, they're still very weak. Even if they don't catch diseases, they do very risky stuff. Their mind is pulling them into many things. They're riding bicycles very quickly, jumping around, and they're prone to injury and accidents. And then you get to a certain stage where you're very strong. This is your strongest stage in life. You seldom go to the hospital. You don't have any diseases with you. You are very smart. You try to avoid accidents. You save money and all that. This is your strongest. This is quwwah. All right? And that's why you're outside the red box. And then you go to the next stage, which is also in a red box. Your immunity starts going down. Your bones become very friable. You can easily break your bone. You become forgetful. You are prone to accidents. Even your immunity, if everybody remembers COVID, the people that really suffered from COVID are the elderly people, because they have now become da'if. They are now weak again. So they are prone to diseases and accidents.
Yo aga kebe kono ko ngana hoike hay screen ke hay presentation ke anna wala box dumbe kebe ga nongani atangana kempa katinga purana jangiro kita wala maybe ko kundambu anene nyane ko lemine nga mo be lemine nga na sare sadaga khorono yo ko sarano ku hakati suina kle to ko lemine ke boni kenta amwani purana jangiro kita yo ane nyane so keda tangana khoro mangana kinye tanjike kata tankara do karo yo kenya na nyini kenta amuna nyi yo anda an koto keta anda experience ko kita yo anai anta hino gono dabarni ka kem pakati ga ngana dangita angana ro ko box dumbe kebe ga ngana nga kinye ken pakati gai a ko ampire na kadi ko jangiro ma wala jangiro misu yo purina kita ane nyani.
Okay. And the whole health system in the world has agreed that these are the stages where you should address when you are trying to control or prevent diseases. And I want to emphasize at this stage that if you have kids, don't assume that they are 10, 12, 13, 14, they're strong enough. Until they become in their 20s, they have become men or women, married and living and having their own children, they're still very weak. They still need our support to guide them. Like Brother Malik was saying now, teenagers think they know what is right for them. They don't. They still need your guidance. You need to tell them what is right for them. Study hard so that you can get a good job, help others, help yourself. They do not know that. I remember myself being a 25-year-old. I did not know that. I am here as a doctor only because my father stood on me. He thrashed me many times when I didn't go to school. He thrashed me when I came second in my class. If he knew I could become first, he would thrash me. So that age still needs your support.
Yeah, to ko lemunu nga mo be ngana koto honne maybe na simana ina hike swatu kati ko sarano ku wa murnu kama kana lemunu ko hakati sunani warai ni nani ino ko kula gono so ati kanye mo be kentamu aganyetele karlanga ko ahaba exam nga bo hilandinga habe keda ko ara toro honne iyo keta kenya ndanya lenga aga kenya aga tembo ko be ko habe kenya ba aganya ndu kula gono aganya sigira batenga yo ko keta ke ko sarano ko tale munu ko ma o me to ngone bo lemunu ko maka ikunna swatu kana ga harsata ko ida warai khirsu warai ida ko iharaji kenga.
Okay. Can I ask us here, anybody that is outside those red boxes, if you're outside the red boxes, can you raise your hand, please? You're more than 30. Raise your hand. More than 30. Alhamdulillah. Is there anybody more than 60? MashaAllah. MashaAllah, MashaAllah. So this talk is for us here. Most of us are above 30. A lot of us are above 60. A lot of the diseases that we see nowadays, diabetes, hypertension, cholesterol, heart problems, they are diagnosed when you are above 60. A lot of them before. Nowadays, we are diagnosing them much earlier. And what we are looking at right now is, if you wait for the disease to happen at the age of 55 or 60, there will be problem, because you'll diagnose the disease with complications. So what we want to do is to diagnose disease or diagnose the potential to have that disease at the age of 30, 40.
Yo kagabe no ko ke digame ni soronya kubenu nga na wuru tanjike sine kata kamundi yo agara kebe ko sukuru jangiro hore jangiro ko ganinga sero kubenu kenya tandu mesine kata kane na kunyara kana kasa sa kensanja sasa na solo kana ko jongarunga yo kaga kebe ko nota kenya ni ko sasa hinga kebe kama mana sigira batenya sado jangiro ke lagana yo.
Okay, any disease that we mentioned like hypertension or diabetes, there is something called pre-hypertension or pre-diabetes.
Kwa kebe kono hiya ko sukuru jangiro hore jangiro ko sado ke ngallagana hiya no ngane gatini kebe no ko pre-hypertension ko kenyani jangiro kebe ngallagana sado jangiro ke megallagana.
Okay, and the idea is to catch when it's pre-diabetes or pre-hypertension. Okay, so WHO, we all agree that they are the ones that know medicine more than anybody else in the whole world. They have defined health as the state of complete physical, mental, and social well-being of an individual, not just the absence of disease or infirmity. Meaning, ma'ana, just because you don't have hypertension or diabetes or stroke or any other disease doesn't mean you are healthy.
Yo kwa kono WHO ko kunyani hibiga ko adoko yonki sankaranga duna no ko yani adoka sare karanga ya marantene kenga so kungada yo ko yonki sahay gara ko mobe nanti ko ayeti ko gelangana jangiro suntanga sukun jangiro tanga horon jangiro tanga kempeti ko nanti ko jangiro suntanga.
Tamam. So there's a difference between being healthy and being well. For wellness, they've also said that it's not just you alone. Even if you're healthy, you might not be well. So wellness has to do with this, the group of people around you and yourself.
Atiko saha ada yonkin saha kunu hinu hilai kantabana. Yo ahetiko ang sante nganai kengure hetiko like anjonkin ka sante nyani at the same time. So kengure ngane kebe alai kenya kono ko like ko different nyani naga an sante ngani ado anjonkin sante ngani.
And the first step is what we are doing here. Come together and realize that there's a problem that needs solution, and that's how we become well.
Kita himpo hana ko oga yonki sa ko kita mo ba kenya ke kundu ko ke me kape kunu kyani himpo hana kyani ko step hana kenya ni wana me ka huye wana diga mo ko hinu kama.
Okay. As Muslims, it is very important to remain healthy. It is clear from the teaching of Rasulullah, you have to remain healthy. And that's one of the components. The next component is the most important for us as Muslims. For other people, it's not the next most important step, but the spiritual one. Islam, Aqidah, Deen, Tawakkul. This is part of the spiritual well-being of an individual. And then you've got other things like emotional, social, as a community, intellectual, the one that Malik was talking about, environment, and work, which is vocational.
Yo ko silama gundi hinu hili silama gunda ke ida ken samba disiri kenya ni himpo wana kenya ni yonkin saha yo ko silama ko makin to ko halana hada maram mi yonkin saha na maga ko anna ma mungo ke anna ma to ko halle yo hilani ngane kebe kenya ni mananka ko ku hinu hili hada islami suga anna ko atiki ko hinu hili ya.
I will take the red one. I will leave the second one for Imamuna, the Imam. He will talk about the spiritual aspect. I'll just talk about the physical one. And this is just talking about the same thing, you know, physical, we are going to talk about this in depth, rest, eating well, living well, sleeping well, exercising and all that. And then we might talk about intellectual, emotional, a bit about occupational and social. Financial, probably Brother Malik will tell us how to save some money. I think he might do it better than me, or Sivi, someone. Right, so in the physical wellness, I'll just talk about a few things. Exercise. what you eat and drink, assessment, how you should go to your GP. I'm sure most of us here don't smoke. Some of us might smoke. I've omitted the drinking alcohol one because I know most of us, alhamdulillah, most likely don't drink. And then I want to emphasize about rest and sleep as well.
Yo, aga diga mun kebe kama ko yonkin saha Kenyan exercise nampate mbogo medi ko igando oga kebe igana kelangana ko cigarette ma kundambo yo ado na ko na rest na ko nan tumani Kenyan ken ko ado berno haranga dagolino ko anani sabatene kandi.
Okay, so types of exercise. We have different types of exercise. A lot of us might exercise. If you walk a long distance, that's an exercise. If you stretch your body, that's a type of exercise. Trying to balance, yoga or any other one, that's a type of exercise. Or lifting weight. These are all exercises. I mean, some people have a lot of gadgets that tell them how many steps they do, 20,000 steps, brisk walking, shaking your hand that way. That's a very good exercise. And this should be part of our life. In the time of Rasulullah, they used to do a lot of exercise. Wrestling, horseback riding, fencing. This is all exercise that they used to do. Walking, they used to do a lot of that. And over the years, they used to do that a lot. Most of the generations that came before us do that. We do less of that. We have cars, we have bikes, we have scooter. So we are doing less of exercise. And I want us to go back to exercising. When you wake up in the morning, every day 6 o'clock or 7 o'clock when I'm going to the masjid, the only people I see other than us are the Sikhs. The Sikh. Why? Because it's part of their deen to go to the park, Victoria Park, to do walking. 70-year-old walking. 50-year-old walking. They have made it a part of their life that they have to exercise. And we have to imbibe that attitude as well. It has to be part of us.
Anjike kono ko na nampate mbogo medi arawanya na ko hino ka bunga hibia ko na nagantano mbogo medi na nagatere parkindi wala maybe ko nan kitu ko tano ko hutu na kumbogo medi ma yoga no dambu yo ko kunsuni ko na nampate mbogo medi yo akara kebe ko gella kenni sunna ni ma faru sallallahu alaihi wasallam kienga ko sayba no ni hankena ko hini ko dabar ni kensuni pour ni patem mbogo medi because kenni yonkin sahanya kagara kebe ko ati ko fajinta mo ngam renkaro angana bakanga surukubenu wala na kesumanu ana gitar mbaka mede kini sik nunyai bone kunga ikundi nandi yo ikundi nandi mana ko mana mpate mbogo mede na yana ma ta onu kundu.
Mashallah. For exercise, when you want to exercise, you don't have to worry about what equipment you have or anything. Just go out one day, walk very quickly. When you start sweating, you have exercised. That's what we call brisk walking. Any walking that will make you sweat is very good exercise, because when you sweat, you have generated heat inside your body, and the way the body generates energy is by either burning the food you have eaten or burning the fat that is on your body.
Yo aga kebe ko ngati ana ko na nampate mbogo medi serga be no ngani ko ngati ko ina mainda barni na ko simme mi bana ko hoywa ko bono ati ko majer ken suya ko anga daga misal nga daga mpate antanu mbogo medi anga tere manga hutita adu ha ampara mpate mbogo media anga hutita boni Kenya ne hoya kebe gande mana.
The benefits of exercise are so many. I'm just listing a few of them here. Stronger body, everybody knows that one. Stronger heart, definitely. Sharper mind, this is very important. I can tell you without knowing CB that he exercises, because whatever I say, he remembers it. This is just evidence that he exercises. See, so it helps you with remembering things. If you are reading the Quran and you can't remember things, start exercising. Let the blood flow through your mind. Oxygenated blood from your lungs goes to your heart and goes to your brain. That's when your brain can work better. You have more stamina. You can stand, you can jump, you can go down, you can do salah without holding your legs and going down like that. That is exercise. You have the reduced risk of falling. If you have good stamina, you will not fall. If you are about to fall, you can balance yourself, and that's good. If you are struggling with weight, burn the fat. That's exercise again. It reduces anxiety. If you are fit, you feel confident. You're not anxious about, am I going to fall? Am I going to be, am I depressed and all. This will all improve when you exercise. Your sleep will be better. If you're not sleeping very well, Walk for a long time, come back home and lie down, see whether you will not sleep. I promise you, you'll sleep. You feel more confident doing things. You stand, you feel your back is straight. You stand in front of people, you are doing your work, you are driving, everything will feel very confident to you. The way you hold your steering wheel when you drive, you feel that it's better when you're exercising. And in summary, you live a better life, healthier life.
Kaya kebe ngono ko na hanu benu ko na ibadu bekota Kenya ni ko ngana mpatemba komedi anga na hakebe kita annan kendo ambutenga nan kendo hakle ke ganan tenku ansi memo ko anta jo mungunu qara kun suko da gelanga na ga maybe nan kenke kenga ko to na maga yo ka Kenya ko no ko nan mpatemba komedi kenna kunsu anande mo na kunsu ya anay keta ko ngana salini anta nan kurungol la ko anta kunsu kita ko misale ko gelanga nay anga ko nan kenke aga ko to na maga anga daga mpatemba komedi na manda ga tere maybe leru me haqqe anda ga tere alli yo ati anga na sako maybe anga kenkene so kun hunu eta agati ne ko kebe ga serena hana anga ampatemba komedi.
Thank you. Now I will take a lot of questions later on if you want, but I have one question only. One very important question. Does anyone know jollof rice? Okay. The question is wait. The question is jollof rice, is it from Nigeria, Gambia or Senegal?
Can I answer that?
Just be careful. If you answer wrongly, I'll walk outside. I'm from Nigeria, so okay, yes. So jollof rice, wonderful food. And I want to talk us through some healthy diets. Okay? There is no unhealthy food. It's just the amount we take that is unhealthy. I'm sure we know most of these foods, yeah? No, I know. I can see that you are skewed already. You're going to say it's a Gambian food or something like that. Sorry, okay.
Like you mentioned about the food.
Yes, I'll mention the portion, yes, yeah, okay. We'll talk about the portion of the food. So no food is bad food. Every food that has come down, min indallah. Allah has provided this food, whether it's fat or sugar or whatever, min indallah, it's good. Don't make what Allah has made halal for you yourself haram. Don't do that to yourself. Every food is good for you, but you just need to take it in moderation or in the right amount, and we'll talk about it. So any of this food here that we can see is healthy. I mean, so for example, if you take a certain amount of rice from that diagram, if you see that one on this side, there's what you call vegetables and fruits. There's what you call protein, which is meat, fish, beans. These are all proteins. And then you've got starch, which is rice, spaghetti, yam, cocoyam, potatoes. Those ones are meant to give you energy, the starchy foods. Protein is meant to build your body. And vegetables help with everything else. They help you wash your gut. They help you with vitamins like iron that is building your blood, vitamins like vitamin B12, folic acid, something that will prevent you from bleeding. So everything else that you get from your food comes from the vegetables. Okay? So the way you see that plate divided, that round thing, you want to have about half of your food with vegetables. Okay? About 1/3 of them with rice or potato or whatever. And then another 1/3 or 1/4 to be protein. Okay? So that is a very ideal plate. Okay? So, but that can be a very big plate, right? You can have a big plate with half vegetables, some protein, some rice, but it's a big one. Again, that is where the sunnah of Rasulullah comes in. You're supposed to eat in moderation. Eat 1/3 food, 1/3 water, 1/3 allow air to move those things around, right? So that is what healthy eating is. Eat what you like, because jollof rice is a popular food in West Africa, but it might not be here. Potato is a popular food here. In fact, some people here, if they eat a lot of rice, they develop a problem called celiac disease, because they are used to eating potatoes all their life. Okay? So divide your plate into 3. Let's even say 3. 1/3 vegetables or fruits, 1/3 your rice or beans or yam or whatever or potato, and 1/3 to be proteins. That is a healthy diet. And then the size of your plate will depend on your size and the size of your stomach. The amount of food I would take would be different from somebody that is taller than me, right? So you have to determine what is in moderation. Yeah, shall I go to the next?
Yeah.
What do you want to talk about?
Sure, that's a very long one. Kwa kebe kono ati igande tadangati ndo igande bure kentari igande sugara asirenyan yo kebe kaneta ko anga igande ke anga kebe igande ke nogondi yo awo Kenya hanyana Kenya asironi ma Kenya na buronin ka kebe kono ko igande mo sunna nyime karanga angana igana takantano sikki yo ana igande ado sikandi igande Kenya ko hankenga na igande ke aga urnu mo be yo ko kaneta bo ngara ko mo be ko maronga bo ni sergabe ko wona maronga banya igana ko maro ke ngana igana yo alla way ko anga ka hidu ko no kapa mare ke no maro ke no gondi yo ko angana igene ana kebe ga ko ko yitire mu ma yo ko kundi menu ana ya maganya maro ke bane yeah.
Shukran. Okay, so the first thing you want to do is don't make a change to start with. Look at what you eat first. Assess your diet and eating habits. Do you eat breakfast very well, no lunch, and then dinner? Or do you eat good breakfast, good lunch, good dinner? Or you don't eat breakfast, you want to eat heavy lunch or dinner? So you have to assess what you eat first. And then the next thing you want to do is you want to take a variety of things that are nutritious. Okay? Don't always eat salad every day. Sometimes eat spinach. Sometimes eat fruits. Sometimes eat broccoli or something like that. We are in a country where vegetables or fruits are abundant. We don't know what they taste like until we try them. Some of them might be very tasty. And a lot of times it's not just about the taste of spices that matters. Sometimes it's the feeling on your tongue. They're all important aspects of feeding. So you want to know what you eat. Then you want to try different things. And then again, like Rasulullah said, control your portion. If you're a tall, big person, you take more. If you're smaller, take less. Only thing is make sure it's 1/3 food, 1/3 water, 1/3 air.
Yo kwa kebe kono himpo hana Kenya na hayanga kebe igana sasa kundu gelangana ko so ampuna ante dakatana manya angana yakama me atoko ma anso ampo Kenya kotono na koto irakatenga ko sere suwana ka Kenya hani himpo hana kwa nga kebe igana sasa kundu hila ninga ne kebe yo Kenya ne ko itere mundo kumeno kawa angana higana na ma dage hibanedi yo alla we anani sanchene yo kenga nande mana hinu kuno gondi.
And then, obviously, I want to emphasize this point. Drink a lot of water. Wherever you go, you see the white man with a big bottle of water. They put some squash inside so it tastes better. Because it's very difficult to drink water all the time. I can tell you that. But if you put something inside just to give it some taste, it will allow you to drink a lot of water. And there's things called water therapy. Some people drink a lot of water and it improves their health. It is confirmed wherever you go, even in cold countries, if you drink more water, your body works better. For kids, about 60 to 70% of their body is water. So if water is the main source substance in their body, that's what they need. For human beings, we have about 40%, 30 to 40% is water in our system. So if you deprive yourself of water, that's a problem. Drink a lot of water.
Ayame lo atoko keni muhi himuna handa nya siri Kenya ne jinkaranga atangana honkulu ko hay gabe wadi ani wala kabangi maga hodinka na jinya ken dogoni burno ga kebe nyana ko en hinu ngano jike no gonni kebe ga dagame kinna honne ana kadu jike minisiri kade jike duro ko inako jike duro burno ga ko dagame ta ko tanya honne ka Kenya gani ko jinga ko sere ma ken to halle na jimmi ko awande manasiri.
Everybody knows Maggi here. Big problem. Okay. Sodium is the same thing as salt. Okay? It's a problematic thing. If you eat the food here, go to any restaurant and eat food, you feel like it's bland, no taste. And that's not because it has no taste, it's because our tongues are used to the food back home, where there's a lot of salt, pepper, Maggi, onga, jimo. It's too much. This does not go away. It goes into your system and it stays. Your kidney tries to wash it out. It changes your balance. So the balance of your kidney, where it's flushing out salt, you're eating more salt, it changes everything. So you want to reduce the amount of salt you take. If somebody that is used to the food here in UK, it's our own food. It's very spicy, very salty. That's because their own tongue is not used to our own food. Okay? So we should try and reduce the amount of salt we take. Same thing with sugar. If you go to any meeting, the only person that is putting sugar in tea or coffee is African. Yes, white man will say it will affect the taste of the tea. Only us, we are always putting sugar in. And I promise you, one of the things that you can cut from your diet to see some change in your body is sugar. So talk about the salt and sugar.
Kaya kebe ko hini ulako sapendo sukuru ati ko sape okugabe wadi angana hay ko yere igande ke igantina andara kame kitai kengureni ya ogade mikebe ya bonuku de mikebe kiyani magi nukudo jimono ku kunyana wi gandu kui yo akake ati kenga kimba hi bure nye kusangana magi nukuiga entatelle ya to kampate kiadi so nan to kenga makota ya arini ho hibonondia yo hilenga ke kenya sukuru ati sukuru mpake ni kenya ni hiya ko angana hay honkulu angana ga mitringa ko angana mitringa honkulu ado hatam minno igana tabalinga anga serebe wala na tinno gon makahe aga sukuru na kenya hatam minne banay boni yo ko kenya ni hinga aga kebe ko ta sukuru gelangana anga lahi yonkin sa anga lahi ko na kitanatu anna sukuru ngento karanga.
Okay, when you go to an event or when you go to a restaurant, eat smart. Don't eat too much because you're at an event or you went to pay the food. So just eat smart.
Yo ko anga daga programu manga daga restaurant daga yige ko anga na yige na anna denga hakilenga ko anna magazine ko anna kasnya tuka puna yige anna yanke na yiga gata anna maganya ko ali jallo yo ko anna denga dam hakilenga.
Fish once a week at least. Vegetables every day. This is very good way to eat food. Okay? You want to talk about the fish? Then I'll go. Fish once a week.
Yeah.
Vegetable. Okay, I should go back. Huh?
Yeah, please.
Fish once a week.
Yeah, ati ko nyere na kenyiga tabane koyendi ko kensirenyani.
At
yo
least.
Ko su tabane yo.
At least, yeah.
Yeah.
Okay. Rest and sleep. It's very important for you to rest. Your body works hard in the daytime. Allow it to rest at nighttime. As long as it is important to exercise, it's also important to rest. Sometimes just sitting down in one place, qailula, just letting your body to rest a bit is enough. That's all you need. And if you're not sleeping well or you're sleeping too much, that's not good. You should see your doctor.
Atako ko nanyang too mandi. Yo kengan hiyai ko important nyani siri ataka ngana hai agara ko mo be hallendi na ko na ko nan tan bogo medi na hanga kenga mobe anna nyonkin ka tumani na hana kenga kundwai ka gelanga nai ko akotana maga ko nan kenga ko kundambu annan doctor ampai.
The best way to do it is if you are going to bed, you are going to sleep. Don't lie in bed a lot of times just reading your phone or anything. When you're tired, go to bed to sleep. Preferably don't put TV in your room. When you're going to bed, it's sleep. TV somewhere else. Don't take heavy food before you go to bed. It will affect your quality of your sleep. It will give you reflux. It will give you acid. You sometimes wake up feeling acid there or pain there. You say ulcer. This is because you ate some heavy meal before you go to bed. Don't take coffee or heavy tea 3 to 4 hours before you sleep because it will affect the quality of your sleep. Try to go to bed around the same time every day. It will just give you your body the routine so that you get used to it. It's hard when you're working a shift. I work duties, shift, sometimes night duty, sometimes this. It's very difficult. But if you have the opportunity, go to bed around the same time. If you sleep for a long period of time in the daytime, just know that your nighttime sleep will not be very good quality.
Yo kwa kebe kono ko awarai kenyani waking bed yeah ko anga daga ko anga barenga mata kenyani ureni prana daga nan kenka na magani anda ma tele ngaran kompendi yo ado maybe mobile no anga daga no ta kindi na daga na sawa yo ado ga saro anga tele sawo anda ma yige buru yo anda ma yige bo sara anga tele sawo kenyani ga ko kahe ndo kunda mo matinu ku anda kunga ko leru siki makata leru karage sara anga tele sawo kahe mama tima anda ken to ngani yo adoga ko anga tala sago time be hakati be yo anda ken garaga ko ana sunya hakati bane yo ken gana ana patake ko ana demindini kenga yo ati ko angana kenga burukiendi yo ana tunandi ko like burundi pour na kenka akotonan kam mahonne.
Okay. The next point I'll not take too long is smoking. Everybody knows it causes cancer, hypertension, stroke, so we'll not talk about that much. If there's anyone that smokes, there's a lot of help with the GPs where they can help you to stop smoking. Now this is the one I want to emphasize on. Physical health assessment, it is required for certain situations. Sometimes when you go to work, they will tell you have to do some blood tests, some health check. They want to make sure you're well before you start that work. Every pregnant woman gets a health check. And by the time you get to 40 and above, you're supposed to get periodic medical screen. And that's for people that are above that age. Okay, and that's trying to pick up certain diseases. And sometimes when you're traveling to certain parts of the world, you need to do some medical check.
Yo akabe ko Kenya ni ko anyon kinsa biru igatini wala ara goli dingre ko igatini ko wate shoda barnanga kene na tuwa ko anyon kinsa ke mo sanga goli ke barni ado ga gelang na rabe warja kan tengani ken ga biru wa ken ga da barni ado ga biru ko ngana kirsa ko honne ko ngatelle andu check ko doctor no nandu periodic check ado ga biru ngana terne ken ga wa mundana ko purna ken da bari.
The periodic medical screening I'm talking about, you go to your GP. Sometimes they call you. Even if you feel healthy, you should do these visits. And the advantage of doing that is they will screen those medical conditions that will happen at the age of 60. They will catch it early. All right? The other thing is the doctors will encourage you to have a healthy lifestyle. There are so many specialist nurses now that can tell you, okay, this is the diabetes specialist nurse. They'll tell you how to control diabetes. This one controls hypertension. This one does that. This one does that. So unless you get involved with your GP, you will not know that these things are there. And at least, for no reason, even if you don't do anything, just know your GP so that when you need your GP, you know how things work there. You know that, okay, I need to call or I need to make an appointment in this way. Don't wait until you need the GP to know your GP. Know your GP very well.
Yo atiko ko agara kebe ko hallendi ko nanya andu check ni ko na itala andu check so agara kebe ko an GP yo keni hiyai ko alla wan GP tala ananda ga ngani ina ampa ina system ke hay nan check so agara kebe ko gelanga nay angana ke ni tandume ma tanyere sine jangiru kubin ngalla gana kun tamuya keta nan to ko tanga tele GP ka walla gande man kebe anai nande mana anga kun jangirono ga kun kabana mobe yo ado ga kun qara wa irawan de mana ko nan ngudun kullahu ana anga kebe no igana wala anga kebe dabarni ana kebe ga nyonke sa kebe ga tallang aga tallan de mana so gara kebe ko kelay ko sere so nan jipi naga anna traita ko diga menyanda annan jipi nukunaga.
So now coming to the bulk of the diseases we are going to talk about. So at a certain age, during the time of our grandparents and parents, people at the age of 50, 60, they used to have stroke, 70, 80 years old. Then it came down to about age of 60. Now people at the age of 40, they're having strokes. You know, people at the age of 40, they're having diabetes, hypertension, heart problem. And we need to, how are we doing with time? Are we okay with time? 10 minutes? 5 minutes?
We're 5 minutes.
Okay.
Maghrib is about 2 to 5.
To 5, okay.
Yeah,
Yeah, okay. So many diseases are happening very early in life nowadays, and we need to address those things. And the best way we do it is to catch the risk factors before they occur. And that's age 40, 50 now.
Yo ani kebe ko agara jangiro kubenu ko be o horan jangiro sukuru ndan jangiro ko kundu menu hallendi kunni soro laga nangana kinya tankarage ma tandu mesine ina laga ken pakati ya sasa ken tagandia sasa kunga honu sero honu laga nana ngana tanagare sine kungira gana awo keda hinu ko sanchi anda ko hallendi ko ganninga aga mobe.
Okay. And these are diseases that can affect men and women. So a woman can have hypertension or diabetes like a man. They can have infections, they can have thin bone. They can break their bones easily if they don't have the right vitamins. So all of these diseases can affect men equally like they affect women.
Ko jangiro nu kagara ko mo be igoro ya gari ana so ara gana eto ko nanti ko jangiro nu ko mebe ana igun kara na kunyara gana siri maya garin kara na kunyara gana siri hani asombana.
So every year the GP will organize. By the time you get the age of 40 and above, you start receiving SMS from your GP. And that's only because you engage with them. So if you go to the GP regularly, when you hit 40 and above, they will start sending you message. Okay, we want to check your blood for blood sugar. We want to check your blood for cholesterol. We want to check your blood for this. It is very important that you engage with your GP so that they can do this for you when it is time. So we do check your blood pressure, diabetes, cholesterol. Nowadays, you don't even need to go to hospital to have that checked. They will tell you to check your blood pressure and record it with them, and they'll keep an eye on it. When it starts going up, they'll pick it up and they'll start organizing treatment for you. So things are much easier now, but you need to engage with your GP.
Yo ate ko sasa anguna kenya tanaka resine an GP ke bino wa messaging alanga yo kengure ke na nyina ke langa na diga mendo anga GP nunaka so kenga ne kebe da ko na nyinan simandina ko anga kawa ko andali tesunda baranga horon jangiro ma kundambu ataka sasa ime ko ida ne wondia sasa ime ga hibenda barni anyi mena da barni ankandi ko ankena maybe result ko ane kenya wala katieta keda ikunyi ni kunya hayni ni kunya hayni ke langa na ko tebe ida hiwar hibe ga ya lagata inan kedi kenda nalli so ke ngure nata kensu wanayi kolo saro jangiro ki gari na jangiro ke kane kutu.
This year NHS got 120 billion pounds. 120 billion pounds. That's the NHS. You know how they got that money? It's from the tax that you paid. So you have already paid for the services. You need to engage so that you can benefit from them. All right? Engage with your GP. I want to emphasize that.
Yo, so aga kebe kono ko NHS yirigi well kasika benyani billion pounds kenyani ke ko kenyani magapuruna ena ko da bari ke ngurenia ken kas kite mare ken gite tax nukara o suga tax ko bentukana ko anga manna magasi manade ko ando GP ko na diga mo daga na lieke wala me ga hibe su nyana ana magasi manade ko like ko kahunya ni firinya no firimbe de anke an kas nyane kenga ko adiga meni Kenya ko anna magasi manade ko la angi tero no kunande ko kedo ke ena kenda bari anna magasi manade ko la hankunwa no ken igol lenya na ko Kenya barni.
By the time you start hitting the age of 60 and above, there are other diseases. And now we start dividing men and women. So like for men, everybody knows about prostate. When you start having problems with passing urine, it's dribbling, you have struggle to pass urine and all that, that's the prostate becoming large. The GP keeps an eye on that because there are treatments to help with that as well. And then later on, there is something called prostate cancer. They can pick it very early and treat it very early. But unless you engage with the GP, they cannot do this test for you or screening test. So you need to engage with them. Okay? Same thing as testicular cancer. That's for men. For women, bladder incontinence. By the time a woman reaches a certain age, because of the number of deliveries she's had, she starts having problem passing water. If your wife has that, encourage her to go to the hospital. There is help for that problem. As well as cervical cancer. They will get message about doing a pap smear. You should encourage them because a pap smear might pick up a cancer very early. If they pick it up, they can be treated early and it will disappear completely. If it's not, then it will spread to the rectum. Then they'll start having problem with surgery and then go into the lungs and the brain. It's all messy. But if we engage with them early, the woman is invited for a test. She goes, they screen her every year, every 3 years. They will pick it up early and they should be treated. Same thing with womb cancer. It's all very important.
Yo aga kebe kono angunga kinye tandume kata kamuni keta ko yigun karano yagarun kana intabana ko yigunga jangalu kibeno ka yigukura kana do yagaruku intabana so aga kebe yigun karanga hi bana yigukura kana kenyani ko ngara jogende aga ko tona maga yo ko kundambu so ken su kitene kamo ke langana andan jipi nganda ko diga mi nganda andan jipi ndaga nganda dele ngani ikan teknika kundambu ndabarni gelangana anga kenda barni su kunna kenya kane kutunu sada kundambu ngala kana ken kane kutu so yagarun karanga kenyani yo so kun kanu ko diga mbani kanita.
Yeah. There's also other special screening tests. People that smoke will get x-rays to rule out lung cancer. If you have a family member, a brother, sister, father, mother who had problem of a cancer in their gut, in their stomach, in their colon, in their rectum, speak with your GP. There's a screening test because these things run in family. Sometimes they just grow as a little beans-like structure. If you cut it out, that's all, it's gone. If you don't cut it out, it becomes a cancer. So there's a screening process for this kind of conditions, but you need to tell your GP so that they know what to do. What they'll do is they'll look at that history, they find out which type of cancer it is, and then they'll recommend the right test for you. It might be just a camera test to look at your gut. If it's all fine, they will not say, okay, we'll not do it again until another time. Or they'll do a blood test, which tells them that, okay, this man or this woman can have a cancer. Let's monitor them very closely every 6 months. So you need to tell your GP.
Ko gila jangire ko gila nganai gam family ko no ni maybe cancer mano ko kundi menu yo angana ko anji pindangani garawa kebe dabar ni ko rawa test dabar nanga test kebe ga ko nandi ko like ko angana continue kundu kane ndi angara wa kenjangiro me kita ana iga kebe dabar ni ko na kenjangiro kane kutu ana magalaga so kunda mo gela nganai ko am family no gondi kunjangiro manga e waga family ke no gondi yo anna ma kuru ke ana kata njipinga inanka ha inanka check ana gela nganai kane ndi arawai anankaraga inaken kane kutu.
There are other aspects of health that we ignore. Our teeth. There are dentists around here. We should engage with the dentist as well. Sometimes they can pick a hole on your teeth that they can block before it becomes a problem and you lose your tooth. Elderly people have lost a lot of their teeth because they didn't have good dental before. Dental services are available. Please engage with them. Eye check. Sometimes you might, everybody, 100%, people that are by the age of 40, they will have problem with reading. So you see people start doing that. It's a normal thing. That's what everybody has. It's just that some people, maybe 1%, have stronger eyes than everybody else, and they might live their whole life without requiring glasses. But most people by the age of 40, they start having problems with their vision. So have an eye check once a year, twice a year. Most of these things are free. If you go to Specsavers, they'll say, okay, eye check is free. If you want to do extra, you pay £20. Same thing with hearing. If you can't hear very well, every time somebody talks, you have to say, can you repeat that again? It's hearing loss, really. You have to ask. Sometimes it just works inside, they wash it out and that's it. Sometimes you need a hearing aid. Okay? If you have problem with hearing or your eyes or your teeth, go see your GP. Not the GP, the specialist. The eye hospital, Specsavers, they deal with eyes and hearing as well. So you can talk to them. And then dental is a separate thing. You need to engage with them.
Yo ko aga kebe ko anga kawa hini kwenda barni ana isino do haraga nyana tabane ai kenya ni ko anka mboku na kun check adoga ko nyago na so ara kebe ko de Specsavers yo ko kuna kenda barni ala wetella ana nyake mpa na ken check adoga maybe inta charge ni kumbo na ko firinya ni kene ka hunye yo adoga antoro gelanga na isorona diga mantina ko sagandiga meke ba anganda kendam kumbo ndambuta yo anandaga ina high so at Specsavers ku hinu hilli erwanya kempani arantoro ikol erwande manekenga.
Okay, other things I'm just going to rush through. You can be sad and you can be angry. You should allow yourself to be able to be sad or angry, okay? And other people can be sad and angry. Allow them to do that. We have noticed that when people don't allow themselves to be sad or angry when it is indicated, or they are not happy when somebody is sad or angry at them, that's not being healthy. If there's something that happened that makes you sad, somebody died, cry, be sad about it. Somebody annoys you, you should be angry, but just be respectful of the other person. If you did something or somebody else did something to them, you should allow them to be sad or angry. This is called emotional well-being. It is just part of the way of life. Rasulullah had losses in his life. His children died, his wife died. He cried, This is emotional well-being. We should allow ourselves to we shouldn't say we are men, we cannot cry or we cannot be sad. We should allow ourselves to be sad when it is right to be sad.
Yo aga kebe kono Kenya ni ko nansuno mana butu mana ngu ko kundambu ko ngati ko maybe ankeni yore nyai yo ankenda sunanda ko anda butu ato anta wunu ko kundambu so aga kebe ko ati fara sallallahu alaihi wasallam ko gelangana ya fati ngana nyama ko asunwa yo ko keni hiyai ko anka manga na maga ke akoto nandu kama anti ko like ko ankenta anta sununo maybe anta wunu ko anna makenda bari.
And be positive, alaikumullah. You should be positive about what you have in life. If you can stand up and walk, be positive about that. If you've got many kids at home, be positive. If you've got grandkids, be positive about that. Don't be negative about what you don't have. You should be positive. This is part of health because we know that this kind of things can affect the heart, can increase the risk of stroke and other things. Okay? Find something to be positive about. It will affect your health.
Ko hinogonu ko anna ni sere kebe ga alla ku fana hinogonu kamma hari nan ngiri nan tere ma dimba ngamba nan ko renga dome yo maybe ko ngani mai na angi wala ko roso kuni hinu ay yo ko annan kawana latiga ku hinu kamma because angana kunda mbunda bari Kenya hande mana anaya nyokin sa ko kenga ha yonkin sa hanye.
Okay. And then if you look at these two words, illness and wellness. The only difference between these two words is I makes you unwell. We, together, we're healthy. Okay? So together, we will remain well. If you stay alone, it is a source of disease for yourself alone.
Yeah, kebe ko kudiga mo hilanga na hay illness alo wellness. So illness kenya jangiro nga wellness kenya ne ko yonkin sa. So atanga na difference ke hay illness ke kempa ken ko lettera I kenya ne ko ko serebane. So wellness yonkin sa nga na hay kempa ken ni wi ko jama. So kenya wuren kenga ko jama ken ni ken yonkin sa nyai. So serebana khibare ken jangiro nyai.
So yeah, so there are other aspects of health that we just need to worry about, okay? But at the end of all this, what matters is you keep well. Aging is not a problem. Being well when you are aged is very important, okay? When you come to retirement, you need to know what your goals are. If you are a young man, you are targeting how to get money. If you are much younger, you are targeting how to finish school or get married and all that. When you are older, you should form your goal. What are you after? Okay? You do exercise, you be thankful to Allah, trust others, be tolerant, relax, read a lot, embrace the age. You are old, but it's not a bad thing to be old, you understand? Or you are 50, it's a good age, Explore new things. You need to teach other people, you need to train other people, and this is what you need to be doing towards the end of your youth, and then so that you can be good at it when you are much older.
So ara kebe ko sere suanga kinyene ko retirement nga ona ko tandume sine ken kama yo an kama nan kawa hamuna managana ko managana ken golunga anke le mania ken pakati ati angana hayanga le muna kunga ange nga kebe muna kenya ni nan karange nyama angana karange kanyama angana lo honna nga ya ko kenya ko nan golina kalsi muru. So an kama ngana ngawa simana angana kinyene tandume sine ken pakati ya annan kawa mana dabarni yo ati kenya ni annan kawasi mana anyo kin saha ko wala maybe nani soro nugulla ko lemunu yamari ko kuni hino ya anay ko an kama ngana kenya ken tembo nga ko benda ban kebe gande mana.
And this is us. It can be old, but it's gold, The way you maintain your body and remain healthy, somebody will still look at you that way. Your body will still be like that, even if it is 20, 30 years old, okay, or 50, 60, 70 years old. As long as you maintain it well, you remain well. All right? Jazakumullah khair.
Barakallahu feekum.
Jazakallah khair.
Yeah. Ayo, just kwa kebe kono ko ko ben ngata were kundu ati ko ida iganu liti wakeni kompeke di dore ana ke da wana hutron salli ana o maga daga wana katu o to hale wana igande ke. So what he is saying inshallah is that like there's some food in the other room. So inshallah for those who are here after Maghrib, if we can stay behind. So it's only people who are here. So if you come, if you haven't attended this, so basically, yeah, so it's not for you. So yes, so in inshallah, so no. So he's saying after Maghrib, after Maghrib, yes. Yes, so after Maghrib, so if you are here after Maghrib, before you go, after you finish your nawafils, and then you can come this room and then we can have some food, inshallah.
Inshallah.
Sure. So we got the questions? We got the questions. Okay.
Yeah, that's fine. Thank you. Jazakallah khair.
Sibi, camera
Off.
Yeah, let's pause it so that's all this. Yeah, just when he finishes talking, you can ask. Uncle Amin. Uncle Amin, we just want to go to questions so that we.
Very good.
Just ask you a question.
Okay, so you said something about water, right?
Yeah.
I like taking like 2 liters in a day, but I used to have lemon or lime. Is that okay? Because I'm looking at acidic level, and sometimes I feel like, am I taking too much of lemon or lime? Okay. Is it okay for me to add lime or lemon to my 2-liter water every day?
It's fine.
Yo aga kebe kon nati ko jinkara ko na jimi nati ko kotanda ke litar no hiliji ana kenya minne ka kebe na lemna mise ko ana kenya runu jike no ko ka gatrindi kebe ko gelanga ken sirenya ni ba an ko lemna mise le nda manta ka waruna atrindi kenya.
The acid in your stomach is more acidic than lemon. So whatever amount of acid you take inside lemon you take inside water, it will not be anywhere near as acidic as your stomach. Yeah, the pH of the stomach is about 5 or 4 point something most of the time, and lemon is going to be about 6.7, 6.8 or 6. It's not, it's fine.
Yeah, so akebe kono ko like na lemna mise lo jinno ko na na mini ko kenda husu torno.
The difference between tap water and this mineral water.
Tap of mineral water. Yeah. That's a very chemical question, but what you're after is just amount of water. The quality of water, I don't think there's a lot of difference, especially in this country, where you don't have a lot of bacteria inside the water. That's what you worry about. But the electrolyte content of the water doesn't make a lot of difference.
A lot of the community are from Spain. Okay. In Spain, they don't drink tap water, so most of them buy bottled water.
That's just because of the sanitary condition of it. Our water here is clean enough for you to drink. There is no worries. Sometimes you can see some lime scale on the kettle and all that. Yeah. So that one is dealt with by your body. You don't have kidney stone or some stones because of that. It's formed from other reasons, not because of that.
Yo, ko akebe kona sorry, yeah. So akebe kono ko pompinji boni ko gabe garu mo be ko gabe ti Espagne boni ku nongani ko kabanji ke wana kenya ko bono. So aga kebe kono ko yere o ga jamane be ko alla pompinji ko problem tiya. Yo alla we mini problem suntiya.
I don't drink bottled water. I only drink tap water. Yes.
I would recommend that for me personally, every day I eat one avocado.
Okay.
I don't know if that is healthy or any other food other than that.
Yeah. You want to?
Ayo ko imam ga kebe kono ati ko akenge ado itireme ko rasu itireme ana kenya gana bane kra atri ni kenya ko ma ken siriyani ba ma ken masiro.
So there are certain fruits that have more of certain things. So for example, if somebody has low level of potassium, we tell them to take banana or tomatoes. They have a lot of potassium inside. While something like carrot will have vitamin A, and green leafy vegetables will have something like iron levels. So unless you have a deficiency of one thing and you're taking that fruit to replace it, then most fruits are about the same thing. The only other thing that you have to consider is what is the calorie content. So for example, salad and avocado have different calorie content. Avocado will have more calorie content than salad, so that's the only thing that you need to consider. And there are very new apps nowadays. Any food you are eating, if you put the app on your phone, it will tell you how much calorie that food has. So if you're worried about how much calories you're taking, you can do that.
Ayo. Huh? Yeah, so his question that he was asking is that a lime. So a lime to add it to a tea, to a hot water, or the lime itself to boil it and then drink it. How is that?
It doesn't matter. So the thing is, your stomach is lined by cells that produce something like mucus from your nose. You know the mucus that comes from your nose. So everywhere in your body has a lining, like a jacket, that produces that mucus, so it protects. So whatever you take, whether it's hot or cold, when it goes inside the stomach, it will just balance it up.
So if it was hot when you drank it and it goes inside, it will become the same temperature. If it's cold when you drank it, it goes inside your stomach, it will become the same temperature. If it's too much acid because it's lemon, when it goes inside your stomach, it's already acidic. So that's where your stomach is meant to. It will balance things. So whether you took it hot or cold, it will just go into your stomach and balance up. But one thing that you should know is if it's too hot, it will damage your mucosa. It will give you burns. If it's too cold, it's not very good for your system. So lukewarm is always good.
Yeah, I guess the question that he was asking is not whether whether hot or cold. What he was asking is that adding the lime to the tea, is that good, or the lime itself, boil it, yeah, and then let it be like not say drinking that. Yes, I think that's his question.
I see.
Yes.
I can't answer that question because it's more a dietary question. As long as it's lime, I don't think boiling it before you add it will make any difference.
Okay.
The one thing we remember is, you see, when you put egg inside hot water, it changes its appearance, right? So any type of thing, if you cook it too much, it will change the quality of that thing. So why do you want to boil lemon before you put it in tea when it's already warm tea? So I don't, unless if it's a cultural thing, boiling things too much is not always good.
Yeah.
What another thing is that if you introduce heat to something, the health benefits you would normally get from that thing you will lose it.
Yo, kaya akebe kono ko lalem na mise nakinka hu kahenga wala ya duro ke nakinga rindi ati kema ima basu wari kenga ko ara kebe ko ko hisuga de angana warindi buru kenga kebe dabar ni anga quality be ga kenyi trimi ana kenya takandini yo ko akema wari nande ko ama problem su wari kenga ko ara hibe warita ko anama warindi buru ma ga dangini yo yo So he's saying that the issue of jollof rice is a very is a big problem that they are having with their with our mothers. So whatever they put inside of jollof, they don't know. So what is your take or what is your advice in terms of that? Because it's something that is causing a huge problem.
First thing is not too much salt. Okay? And then second thing is, even if you are going to eat that jollof rice, eat it in a moderation. Okay? Don't eat too much of that jollof rice, because the biggest problem is not the spices that they put in there only, is the amount of rice you eat. The amount of rice you eat is high carbohydrate. It will build up in your body, it will build up your blood sugar and all that. So less salt, less amount of the rice.
Yeah, so iyo aga kebe ko na jabi kenya gani jollof rice ke kenya chef ke karanga so kebe ko no ko yamari kenya ni sapema na ken takandi kenya ni himpo hananga ado hilalinga ni kebe kenya gani ko oga hakke kebe gana maro kay yo wanda kato kumpin hilo control nuta yo kenna wode mana. Is it time? We
have one last question. Okay, two last questions. Please go.
So yeah, so he asking, his question is like the oil, the amount of oil that is being used. So is it that not using at all, or there's a quantity that is advisable to use that?
The quality is the most important thing. So for example, if you are going to eat food and you want to put oil inside, olive oil is always better than vegetable oil, and vegetable oil is better than animal oil. So if you are just going to put it inside, olive oil is good, and always is moderation. Don't put too much of it. You're putting it to add taste, to allow you to eat it and all that. Too much of everything is not good. But the quality is the most important thing. Olive oil better than vegetable oil better than animal oils.
Yo, so aga kebe ko teke karanga quality ke Kenya important ni kebe ko be ko olive oil, vegetable oil ko kunda munya ta onka kunya Kenya koroshin ado ga ko ga hakke kebe ronai yo Kenya kumbi ko hinu ile ko anga koroshin. Yeah. So his question is